Reporting live from the Red Carpet Studios in Memphis. Thanks for watching Conversations with Betty LaMarr. Betty is renowned for her successful medical talk show. And now you're invited to watch this space for her new production, Conversations, which is laser focused on the health and social issues affecting Memphians and the Mid-South community. And now, your host, Betty.
Hello, everybody. I'm Dr. Robert Wegner. I have the distinct honor today of guest hosting for Betty LaMarr for Medical Talk. Today is going to be a very exciting and informative show. I have two patients here today. You'll meet them both here in a minute. Both had weight loss surgery about 4 years ago, and they're here to tell us their story about what motivated them to have surgery, what their life was before surgery, and then how their life has changed after having weight loss surgery. In today's climate, I can clearly say that weight loss and obesity are in the news every day with all the new treatments, all the new medications that are being introduced to the market. It's become a real hot topic of conversation. Surgery is still, in my opinion, and really supported by data, the best long-term treatment of morbid obesity, as far as not only losing the weight, but curing hypertension, type 2 diabetes, acid reflux, joint pain, all these type of things that go along with obesity. So that being said, let's meet our two guests today. We'll start with Miss Pamela Lindsey, and seated next to her is Lena Bobo. Is this exciting for you guys to be here and talk about your life experience and change with this weight loss surgery? Let's start with Lena. What was your preoperative condition before you had your surgery, as far as medical conditions, your weight, and things like that?
Oh, I was very sick. I had accumulated diabetes. My weight journey had gotten just way out of hand. I was climbing the ladder almost to 300 pounds. I have a couple of issues that caused me to have different medications to take that would make me gain weight. So it was a fight for me to gain and lose weight. And so I was exercising and trying to do a so-called diet that I thought would work for me, and nothing was working. I would gain 5, lose 10, gain, just a yo-yo. And I was just at all ends. I didn't know what else to do. And a friend of mine happened to stop by my house, and she looked amazing. I said, "What? You look like a kid. What happened?" She said, "I had weight loss surgery." I said, "Are you serious?" And she said, "Dr. Wegner." I said, "I need all the information that you have." And she said, "Are you sure?" I said, "Yes," because she also had a few of the same issues that I had. And I've been fighting for 20 years. And I said, "I'm just tired. I got to do something." So she gave me the information. I called. Immediately they answered. They got me signed up for a conference, came in. I mean, everything was like clockwork, no problem. Anytime I had a question, someone was always there to call me back and give me all the answers. So I had to follow up with my doctor, and they thought it was a great idea. You know, it's your decision.
So this was about 5 years ago.
Yes, it was about 4 years ago.
4 years, because it took about a year or so, right, to get your surgery ready or set, or was it longer?
No, it really didn't take that long.
It wasn't that long.
It was
Less than a
actually,
year.
it was right after the pandemic, and we had talked about it before the pandemic, but everything shut down. As soon as everything opened up in June, I went straight to her office, and I said, "Hey, can you sign those papers?" She said, "I'm gonna sign them today, but it's probably gonna take them a week or two." She signed those papers on a Tuesday, and your office called me the next day.
Right.
So they got me in, and I was just so excited because I just had to do something. So following all the directions of what they had me follow on the diet, before, post-op, and pre-op surgery and stuff. It was really hard at first, but you have to understand that it's what we want. If you really want to make a change in your life, and you want your health issues to get better, and you want to live a better life for your children and your grandchildren, my idea was I want to be able to get outside and enjoy my life. I'm almost 58 years old come July, and I wanted to start traveling. I want to start getting out so I can maybe run in the park just to be able to enjoy it. And I wasn't doing any of that. All I was able to do was sit at home and hurt and just be depressed because I was so heavy and I didn't understand what to do. The diets wasn't working, so I was like,
So you were ready for a change.
Yes.
And that friend coming to your house was the kind of the light bulb, like, wait a minute, what did you do? I want that, right? Now, Pam's sitting here shaking her head. I'm assuming you're going to echo some of the same thing. You're about 4 or 5 years out.
I'm 4 years out.
And medical problems before surgery?
She is singing to the choir.
Similar.
Preaching to the choir. I had some of the same problems that she experienced. The way I got attached to you was through my doctor. And I had been going through this process probably about 20 years of the weight, of the diets, the trying to do the yo-yo, doing the exercise, hurting myself, twisting the ankles, had to have the knee fixed and all that, gaining the weight, losing the weight, gaining the weight, losing the weight. My weight problem started right after I had my first child, and had some complications and having to go on medications to try to fix those complications, steroids, birth control, things of that sort. Trying to lose the weight, doing the diets, trying to do the exercises, wasn't working. My doctor said, why don't you try this? And she gave me the packet. She gave me the packet maybe 3 or 4 times because she is a St. Francis medical doctor. And I'd take the packet and I was like, well, do I really want to do this? Because, I've seen so many times where people have gained this weight back and do I want to go through all this pain of this surgery? And the biggest thing is, oh, if I do this, maybe it's not going to work for me, because I've seen so many people say that they can eat through this thing and all.
So that was a fear.
That was a fear
you had.
I had
that this wouldn't work. You'd be unsuccessful. This be another, not gimmick, but another failed attempt.
Exactly.
Right.
And then I had so many other things going on in my life. I was, my child was going here. He was doing this, and I'm the kind of person that I always put other people before me.
Yeah.
So. I want to make sure my son is able to do this. If I have to have this surgery, then I can't do this for him. I got to make sure that, because my husband was in private consultant and I was the main parent at the time. So, I can't be down for this amount of time. What if I get sick and then I can't take my child here? I can't do this. I can't do this. So I was always thinking about somebody else, never thinking for myself. And so at the point where I said that, okay, enough is enough. You really got to do something about this, because the last physical exam I had, my doctor was like, your cholesterol is out of control.
Dangerous.
Yes.
Dangerous. Your blood pressure is out of control. Dangerous. I can't put you on any more. I don't
You're
feel
maxed
comfortable.
out.
You're maxed out on this medication.
And I'm sure they said lose weight, exercise, eat better, right?
Exactly.
And that's what you heard for
my
decades, right?
Endocrinologist.
Endocrinologist for the diabetes.
My diabetes, I went in, my sugar level was 500.
Your A1C was difficult
12. It was a 12.
To control.
Immediately she was like, okay, we got to put you on this. And it was hard to try to maintain and keep it down.
Right.
And then I'm exercising like she said, so you're determined to get it off. And I fell. I lost the feeling in my leg. I had been walking downtown, I got home, and I just fell. And I could not walk for 2 weeks. And I was like, okay, I started praying, I got to do this. I got to do this. So to make my mind up to do this was one of the best decisions that I ever did in my life.
So on that note, I'll reiterate that all the diet and exercise in the world was not going to make the changes that you needed, wanted, or had to make, right?
No.
Right.
And yet, that's what you were being told year after year to do.
Cut back.
Right?
Diet,
So it's very frustrating
exercise.
from a patient standpoint to be being told, then you try it and you do it and it works, but then it doesn't work and you're back and forth, back and forth. So my point is that with all these new medications, finally, we are acknowledging that obesity is a hormonal disease.
Yes.
And all the diet and all the exercise is not really going to address the root problem of your hormonal imbalance in your body.
And not to mention the food.
And yes, so along with the surgery, you have to do the lifestyle changes.
Oh, yes. Oh, yes.
The eating, the exercise, the vitamins. But it's not difficult, would you say?
No.
But see,
no.
the doctors will give you list.
Of
Follow
what to
this
eat, not to
diet.
eat.
Follow this diet. This diet works. And I have a folder
Of diets.
Yeah.
Yeah.
I have spent money
Too bad
going
it's not
to
worth anything.
different doctor centers, this center, that center, another center. None of them worked.
Right.
But this was the answer for me.
Yes.
And like I tell people all the time, because at first when I decided to do this, I didn't want to tell anybody that I was doing it. Again, that fear of it not working was still there. And I didn't want to tell anybody that I was doing this because if it didn't work, I didn't want anybody to say, oh, she had all that surgery and then she's still. But then after a while, when I actually got it into my mind, into my psyche, I was like, you know what? Forget that. I'm doing this.
Yes, for you.
And I'm doing this for me. And I don't care what nobody else says,
Yeah.
Forget whoever says, you're not going to do this, you're not going to do this. I had to get all that doubt out. I pushed all those people out of my...
Just for the listeners, you both had a gastric bypass.
Yes.
Right.
And it was both about 4 years ago.
Right.
Yes.
And you've each lost over 100 pounds.
I've lost over 100
if I remember correct.
Yes.
And when people hear that, I'm not sure if they understand how much 100 pounds is. So I always say, just go to the gym and just try to lift up a 50-pound dumbbell and then go to the 100 and just try to lift it off the ground, but don't hurt yourself. My point is, that is an enormous amount of weight that you were carrying around on your body day in and day out. Get up in the morning, go to bed at night. You've carried that around extra that you did not need.
Right.
And what that shows is that when you make those changes and lose that 100 pounds, how bad it really was.
Yes.
And then to now, how much better do you feel, Pam?
Oh, so much better. The sleep is better. The walking is better. I think I've stated before, you're not afraid to go to places because you don't have to map out the bathroom situation.
And that's real, right?
It's
when
real.
you're morbidly obese and you're 100 and plus pounds overweight, you have to think about those things.
Right,
that,
right.
That normal weight people or people with a normal BMI, don't even think about. It doesn't even cross their mind. But when you're going out of the house and you're 100 and some pounds overweight, you have to think about where the bathroom is, how you're going to get there, how you're going to get home, the walk from the car to the restaurant. You're going to park in a handicap, or you're going to park a mile away. So all these, and then there's the anxiety.
Yes.
The worst part for
Did
me
you
was
guys-
I hate shopping.
Oh, yes.
How about shopping now?
I hated
Oh,
shopping.
love it.
Now all of a sudden you want to go
I
shopping.
hated shopping. To
Yes.
have to buy
Yeah.
clothes, it
Right.
was dreadful.
Anxiety.
Anxiety.
Oh, it was terrible.
And the other thing was,
See,
it's
now we're getting
like,
into, now this is the stuff I wanted. This is the meat.
Okay.
So
Oh.
now tell me about this shopping, because women are going to want to hear this.
Because when you're a certain weight, now I'm not saying, some people are comfortable in their
Right.
skin. Okay.
and I'm not knocking
So,
anybody. who
right.
is
Okay, let me say something about that. This push now, where people are not, I'm going to say politically correct or incorrect. Being an obesity surgeon and a weight loss surgeon, I have no problem telling somebody that they are overweight, they're morbidly obese, and you need a gastric bypass to change your life. Diet and exercise aren't going to work. I have no problem saying that. I know it's true. I've been doing this 14 years, 6,000 surgeries. I have the evidence and the experience to back it up. But in general, society is very touchy
Yes.
about talking about someone's weight or being overweight. But I am not going to fall for or get on board with it's healthy to be 100 pounds overweight.
Right.
Now, you may be comfortable in your skin,
Right.
but you don't tell me that that's healthy, because
healthy.
I know that it's not. Medicine tells me that you're not healthy, and the data says it. Now, whether or not you're psychologically comfortable, that's up to you.
Exactly.
But I tell people, if you want to get healthier, losing that weight and having a gastric bypass will help you do that. It has nothing to do with your comfort level of your psyche.
Exactly.
Right.
But I will also say that when, especially when they lose the weight, do you not feel better
Yes.
about going shopping or going out of the house?
Definitely.
Yes.
Right?
I'm
Yes.
excited to go shopping. I
Because
love
you know,
shopping.
when in the past, you know, when I had the weight, you had to make sure that when you were going through these stores, I would peep around the corner before I went in the
What are you
store
looking
to
for?
see, is there a plus
Plus
size
size
area
area?
section
so
in
so
that
that's a
store?
consideration.
Yes.
So very
Because-
few stores.
Because sometimes you would go into these stores and the salespeople would look at you like, baby, we don't have your size.
You're in the
up
wrong
in
store.
here. You're in the wrong store. We got another store down the hall.
Which
then
must
when
be
you go-
for
psychologically
you,
very
and that would
difficult,
crush you
yeah.
sometimes.
And you don't want
because-
to change clothes there. I would buy my clothes, take them home,
Take
and
'em
try 'em
home
on,
and try 'em
then take
on.
them back.
So
if
do
they
you
didn't
think
fit.
other listeners that are listening now, the thousands of people out there that you're talking to, do you think the other women are echoing what
Yeah.
this is a real thing?
It's a real thing.
Okay, so what would you tell them?
I would tell them that, hey, this I feel 100% better. I love going shopping now. I can shop online without a second thought now. Before the shop online was like, oh, is this gonna fit? Oh, I don't know if it's gonna fit. Now I got to see if I'm gonna get a small or extra small,
Yes.
or, you know, so to that nature. So it's a lot better. I feel a lot better when it comes to that. And a lot of people that I talk to, you know, people will attack you when they see on your journey of, everybody has their own opinion. So when they say, oh, you had gastric bypass, I've never been one to be ashamed to tell anybody.
No.
I want to share my story from the beginning. I let everybody know I did this and I did this for me.
You took accountability.
Right. I wasn't
and said,
hiding
I
it from
need
anybody.
this.
I did this
For
for
myself,
me,
yeah.
my health. Whether you approve or not, it doesn't matter. It was for me and my health, and that's why I went with that. And they were, oh well, you know, everybody has their opinion. Well, this is wrong, and you shouldn't have did this. And no, that's the easy way. I tell anybody out there that says this is the easy way, I challenge you. I promise this is not the easy way. It is a very, very difficult task, but it's worth the breath
Yes.
that you breathe.
Yes.
I would do it 3 times if I had to do it again. If I ever say I had any reason or to think that
Any regret?
any regrets would be that I didn't do it sooner.
Sooner.
Okay,
Sooner.
let me ask you this then, and you can answer this one.
Okay.
When people say it's the easy way out and they think that it is, sometimes I'll say, yeah, it doesn't. Why wouldn't you want to take the easy way? Why do you want to continue struggling 2-3 day working out, dieting and exercise? It's not even working, and you're breaking your back. I mean, you're sweating bullets day in and day out. You're not getting anywhere, spinning your wheels. And I come along and do a gastric bypass, and now all of a sudden, you're modifying your eating plan and doing a little, and now it's working. Now I don't know if that's easy or just more effective. I
It
think.
changed our lives.
Right?
It's
It
a
changes your
lifetime.
life, but what I would tell people is don't get it twisted. This is not a one-stop shop.
Right.
Okay, so what this does is makes it easier.
Easier or more
Okay,
efficient,
and
better.
more
Right,
efficient
right.
and better, because you still have to do your part.
Yes.
You still. I
Every
don't
day.
call it a diet. I call it a lifestyle
Lifetime.
change.
Oh, that's excellent.
Life.
Fantastic.
Okay.
Yes.
So what you have to do is that when the one great thing about this program is that they don't just do the surgery and put you out there
Right.
and say go for it. Here's your plan.
Right.
You do it. You have the nutritional classes.
Right.
You have the emotional support.
Right.
You have the group session support. The nutritional support you can call your dietary.
That's true.
And they're always
and
there.
They're always
They're gonna
there.
call you back.
You can say, hey, I'm eating too much of this or this, and they
They're
tell
gonna
you, hey,
tell
well,
you
try
what's-
this,
exactly.
do this, you're doing this, you're doing
Yes.
this. Are you taking your vitamins? Are you
Yes.
doing this? Maybe you need to add a little bit more of
And
this
that's an
and do
important
this.
part, what you said. You must
Exactly.
take your vitamins.
You must take your
in order
vitamins.
for this to be effective and do what you're supposed
Everything works together.
Yes.
And so, again, it's not easy, but this makes it easier. And why would you not do something that is
That's what I
going
say.
Yeah.
to support what you
Why,
really
you know,
need
if I
to
asked
do?
you to go to Nashville tomorrow, well, you could walk or you could drive. You're both right. Why
Right.
wouldn't you drive?
Right.
Why wouldn't you take the most efficient?
Right.
Not the easy. It is the easiest way. My point is, why would you work extra hard for the same thing? But this is even different because you know it's going to work. Not every patient, gets fantastic results like you, but I would say over 90% of them do. There's always non-responders
Yeah.
to every surgical treatment or intervention that we do, and some people just don't respond well to any intervention. But 90+% of the time, when someone has a gastric bypass and they need to lose 100+ pounds, it's going to happen. It's going to happen within a year to a year and a half.
Right.
Their diabetes is going to go away. Their blood pressure is going to come down. Their acid reflux is going to go away. Their joint pain is going to go away.
Yes.
So many things,
Right.
among others, that are going to change. And you two are a testament to that.
Right.
And so, when you're telling people about your journey, before surgery, and you talk about some of the anxiety and apprehension, what would you tell somebody who's thinking about going down the road and is scared that maybe they don't have a support system, maybe they're scared, or someone saying don't do it? Lena, what would you tell them?
Well, a lot of people have different. When I was going through it, people were throwing things at me like, "You're gonna lose your hair." They
said your hair was gonna fall out?
Yeah, they
Yeah.
said your hair is
You're
gonna
gonna
fall
lose your
out.
hair.
And this is my hair. This is 100% my hair. I did not lose hair. So,
So who told you that?
I mean,
An
it's just
expert?
these are people,
A
people with
medical
their
expert,
own.
a friend of yours?
Right. It's just people. I'll tell you, I'm on social media, and there are different groups out there that are gastric bypass groups, and I'm in there, and I let them know that these are not doctors. These people are giving you the wrong information, and I direct them to your hospital and say, these are the people that can help you for anything or any questions that you may have, because these people on here are not guiding you. They're telling you, oh, you don't have to take your medicine. Oh, that's not true. They're telling
God,
you your
that's so
hair is
dangerous.
falling out. It's
Or you
all
can never
kinds of
eat.
stuff. So yes,
So
I mean,
act
you-
like you're going to throw up all
Yes,
day,
yeah.
and all these horrible
right,
things, right?
But if you follow the directions that are given to you, and to me, this is something that you have to do from the heart. If you haven't made up your mind that this is something that you really want to do for you, you're not going to succeed.
You're not going to
You
succeed.
have to take it in and say, I want to do this. And I want to be successful.
Right.
You can do this, but
Yes,
you
you
got
can.
to stay on that path. And yes, people fall off, but get back up
back
and start all over again.
I've heard people, as a matter of fact, one of the ladies that I told at work that I was going to have the surgery, and she immediately showed me her scars where she'd had the surgery. And I'm looking at her like, well, how long ago have you had? She said about 10 years ago, but I gained all mine back. And I was like, well, when was the last time you saw your doctor? And she says, well, I stopped going to them after about 4 years. And I was like, well, do you think that might have something to do with maybe why you're gaining your weight back? I said, well, are you still taking your vitamins? Girl, those vitamins were too expensive. I was like, I see you bring in.
But you can get Starbucks every morning.
Exactly. I said,
Right?
well,
You
I
can
see
get a
you
$6
bring
or
in
$8 coffee. You can go to
hamburgers,
lunch every day and,
these big breakfast sandwiches.
Right.
And after I had my surgery, and I'm still looking at people who's had these surgeries, and I was like, how in the world can you eat that kind of food?
Yeah.
By getting
But
off of
having
track,
it
and
at
then
surgery.
they allow themselves to go past that mark.
Right,
You
so-
can feel when you're hungry, and you can feel when you're full.
And my stomach
And when
tells
I'm
me,
full,
that's enough.
Done.
done.
enough.
Don't push it.
And you
Don't
listen to
push
it.
it.
And I
Yes.
listen to
Don't
it.
push it. So if you push it, then you'll get sick.
Yes.
Yeah.
But you have people that don't care.
Don't
and they're
care.
like, you know what? I'm over it. And they'll just give up. But you can't give up if this is something that you really
That
want a
you
life
really
change.
want.
And I don't want my health to go back to what it was.
No.
I do not
No.
want my health
I
to go back like
refuse.
that.
Are you taking any medications now
Yes,
for
I
maintenance?
am.
What are you taking
I'm
for
still
just maintenance
taking-
wise?
I have fibromyalgia, so
Oh, okay. Just
I'm
kind of-
taking just a little gabapentin
Yeah.
because mine is nerve related.
Yeah.
So that's about
about you,
it.
Lena?
And then I have
And allergy medicine.
Uh-huh.
I
Everybody
have
has that.
cerebral tumor syndrome, so
Yeah.
I take acidolamine too. So I take that, and then I also have a shifting spine. So I have to still deal with that, but it's nothing like it used to be.
But the
Yeah.
weight loss
yes,
has helped.
it
with
has
the
helped.
pain,
It
hasn't
has helped.
Yeah.
Yeah.
Because at first, I mean, when I had as much weight on it, it was terrible. I was walking with a cane.
Yeah.
Okay, I don't have to walk with that cane anymore. I'm still in pain because of the way it is, and it's the nerve in the bone. But as of the weight loss part of it, that helped.
Yeah.
Yes.
And I tell anybody, it
Changed
does
your
help.
life.
Yes, it changed it.
You two are both so inspiring.
It changed.
How you, first of all, saw you had a problem, knew what you were doing wasn't working, and then you found the solution and you went ahead and did it, and you're living the lifestyle that you need to live to maintain the changes.
And one more thing, doctor, that I want to tell you, I have not changed from day one. I have, I'm sorry, but my phone goes off every 2 hours because I eat every 2 hours.
Yes.
Okay.
I still, it's 4 years.
A small
and
portion.
I still
Small
have,
portions. Yeah.
I eat protein.
Oh, that's excellent.
Every 2 hours, and then I
Yeah.
still eat my meal, like my
4
lunch.
years later.
and my-
Yes.
So you're
4 years
still
later.
doing
The
And
same.
I
what you're
do
supposed
not,
to do.
I do not drink with a straw.
all the things we teach you.
Yes.
I
You're
do
still
not
doing
drink
it.
with a straw. I have not eaten rice. I have not eaten
I call-
All right.
pasta.
I'm going to
and I
have you
do
call
not.
some patients that
I call it the
that
anti-white
I'm
diet.
on their case once in a while for
And I do
not
not
following the rules.
I do not drink soda.
No.
4 years.
No.
That's great.
And your skin
That's
is
it.
so much better, isn't
Thank
Yeah,
you.
you both look. I mean, you both look fantastic.
Well, I'll be
obviously.
58 in July.
it? And
So-
I just turned 59.
Oh, beautiful. So yes.
All right. So, you two, like I said, just so inspiring. I think the viewers, you know, that you've talked to today, I hope they get a sense of how much you've changed your life for the better. So I just want to say congratulations
Thank you.
to both of you and allowing me really to help you, which I love to do. I love, this is the best part of my job, is hearing the stories of patients like you that have had the surgery and really changed their life. I can never get enough of it. And I'm always amazed at what I hear. So thank you for sharing.
We
thank you
appreciate
for
you.
having
And one
us.
thing
Thank you for
about
sharing.
you that I would love to tell the world, Dr. Wegner has the best bedside manner
Yes.
that you
Thank
could imagine.
Yes.
Okay.
According to other people on social media that I have listened and read about, I don't have to mention other doctors, but our doctor, Dr. Wegner, has the best. When I say after surgery, he was there.
Yes.
He came to my room, he checked on me. Before I went home, he wanted to make sure everything was together and I was okay before I left that hospital.
Yes.
And after you leave the hospital, of course, you keep going back. You have to follow up with your health care.
Yes.
You go back to the hospital, and if they say come back in 4 months or they say come back in 3
Go
months,
back.
go back. They say, and if you feel like something is off, and I'm gonna tell you, I did like your friend. I got sick. I was so sick. The smell of food just made me so sick, and I didn't understand what it was. I was listening to somebody else that had a sleeve, and they told me, oh, my doctor said I don't have to take those medicines anymore. I said, oh, we don't have to take that? Now, I know that my paperwork said, and I stopped taking that pill, and I got sick, so I called the doctor's office, and she said, did you not? I said, no, ma'am, I didn't take it. She said, get to the pharmacist. I went straight
Get
to the
back on track.
pharmacist. I went straight to the pharmacist, got that medicine. That stomach ache stopped. I understood from that point to this one. That was 3 years ago or 4 years ago when it happened, because it was like 6 months down the line. I take my medicine every day. Every day. I will not miss it. So I'm doing very well, and
Fantastic.
I thank you with everything in my
It is my
body.
pleasure.
I appreciate all that you have done for me.
You're very
And
welcome, both of you.
Thank you so much.
So on that note, we're going to wrap it up today, and we'll see you next time for Medical Talk with Betty LaMarr. I'm your host, Dr. Robert Wegner.
Thanks again for watching Conversations with Betty LaMarr. Tune in on Fridays at 9:30 p.m. on Xfinity Cable Channel 70 and simultaneously on Channel 1091. For more great shows, subscribe to Betty's YouTube channel, Betty LaMarr Memphis. And be sure to watch this space next week for more inspiring conversations with Betty LaMarr.